Everyone across the country stunned at learning the news that Stephen Twitch Boss, known for his fun-loving vibe on The Ellen Show, took his own life at the age of 40, leaving behind his wife and 3 children. The shocking story coming at the height of the holiday season, a time that can be very challenging for, really, if we're honest, most of us, many of us, right? But if you're already having some serious mental health struggles, it can be a particularly risky and challenging time. So new this hour, Dr. Sophia Palsdottir from the Mental Health Center of America is joining us in studio to discuss some of the suicide warning signs we should all be aware of and how to process such significant grief. So thank you so much. Before we get into our conversation, we do want to remind you that you are not alone. There is help out there for you, and we're putting up a reminder that you now text the Lifeline suicide hotline there with just 3 digits, 988, even quicker to get access to somebody who is on the line trained to talk to you in a time of crisis. So Doctor, thank you so much for being here. Of course, this story really captured a lot of people's attentions because those who spend time on social media feel like they knew DJ Twitch. They feel like they knew his family. They saw him and his wife performing, full of joy, dancing, you know, sharing these moments that seem to be, you know, so vibrant and full of life and appreciation for what they have. And then you hear this. So I think it's a reminder that we really never know what people are struggling with.
Absolutely. Absolutely.
What do we need to be aware of, in particular, during this time period of the year that is particularly hard?
Yeah, the holidays can be particularly hard for people, and unfortunately we sometimes see a rise in suicide rates during the holidays. You know, even though we want to talk about suicide as a preventable, there aren't always obvious signs to someone contemplating suicide. You know, people who are contemplating suicide can look like any other person in your holiday party, and they may not show obvious signs. That makes it even more important to raise the awareness, to silence the stigma, but increase the talk. And, you know, talking about and asking directly how people are feeling. Research shows that people won't necessarily, you know, volunteer those informations and how they're feeling, but if they're asked directly, they may be much more likely to disclose it, and that can save lives. So
that's a really good point, because I think that there are a lot of people who are afraid to say that word, like, are you feeling like hurting yourself? Or have you ever thought about suicide? How are you emotionally? As if introducing that concept would be, you know, something that would make somebody consider that had they not. It's actually broaching the topic that can be a life-saving conversation.
Absolutely right. It is much less likely when you ask somebody directly if they have thought about suicide, if they have a plan to suicide and how they're feeling. It is much less likely to lead to an action than it is to decrease their pain, to feel that they are now cared for, that somebody reached out to them, they are listened to and heard, and it gives them an opportunity to talk and have a discussion. That discussion can be life-saving.
Yeah, and get some support in seeking further resources. That can be a game changer. We shared, I think, on our screen a couple of the signs that can be an indicator that somebody is spiraling and it's time to intervene, you know, the dramatic shifts in behavior and all of that. But I'm glad that you mentioned so many times you won't be seeing those signs. So in some cases, maybe people will be demonstrating these things that, you know, show, you know, risky behaviors, or, you know, leaving their activities or removing themselves from the friends and family they've enjoyed. But oftentimes you won't see anything. And it is important for those people who survive this kind of loss to know that they are not to blame, and it isn't something that they could have prevented necessarily.
Absolutely. Losing someone to suicide causes an incredible pain, and often the first things is shock and grief that consumes people. So acknowledging that pain, recognizing it, validating it, and knowing that even though it's an incredible amount of pain and tragedy that you're going through, life will continue and feelings change, And what you're facing today may not be what you're facing in a few days or weeks or months. And it's important to bear that in mind. It helps you tolerate the intensity of the pain while you're experiencing it in the moment. But reaching out, not sitting in silence with it, because we also know that people who have lost someone to suicide, they are at risk for suicide. So it is important for others to, if you know somebody who has lost a loved one to suicide, to reach out to them, check in. And it doesn't have to be a long conversation. It can be through a text. It can be through a brief phone call. Just that reach out can really, really be life-saving. And then for people to find someone in their community of support that they feel comfortable talking to and reach out for professional help. Grief therapy and counseling can be tremendously helpful to work through some of those intense feelings, because losing someone to suicide causes very complicated feelings.
Oh, sure.
Often there's intense feelings such as shame and guilt and remorse and unanswered questions that may never be fully answered. So it's important to have a space and show yourself grace as you're working through that as well.
Such a good point. I would imagine in that circumstance, more important than ever to be able to maybe find a group or find other people who have experienced the same specific type of loss, to be able to understand what you're going through and voice it out.
Yeah, loneliness and isolation are high risk factors for suicide. So we need to wrap ourselves with our community and loved ones and reach out to one another, especially this time of the year, where many are feeling lonely and isolated.
Yeah, and it's true. The song says most wonderful time of the year. Obviously, we know statistically that's not the case for many. So we do need to be compassionate and understanding that that's the experience for so many people. Doctor, thank you so much. The Mental Health Center of America is where you're joining us from, and that's here in Central Phoenix. So yet another resource for those in the Valley. Appreciate it.
Absolutely.
Thank you very much.
For having me.
And again, of course, we want to share this with you again. There is just a text or phone call away to some help if you are struggling. So please do make sure that you share that suicide lifeline in your life. The text is 988 for help.